Hello everyone, it's Dr. Cary Yurkiw and welcome to our webinar today on advanced stretches and exercises for back pain. You may have come to our previous webinar on stretches and exercises for back pain. At that webinar, participants asked for more advanced stretches. So this is part two of stretches and exercises for back pain. If you have any questions, feel free to type them in the chat window. Be happy to answer those questions. And we'll spend the next 15 to 20 minutes going over some slides, and then I'll take your questions at the end. My name is Dr. Cary Yurkiw. I'm a chiropractor, and I've been practicing for 26 years. I started my career off in Winnipeg after going to Toronto to chiropractic college. And chiropractors now get 7 years of education. The first 3 years, they usually get a Bachelor of Science and then a 4-year Doctor of Chiropractic. When I went to CMCC in Toronto, I had 2 years of pre-med, which was the prerequisite at the time, and then 4 years of chiropractic college. I really enjoyed being in Toronto, learning about the body and how it works, and then returned to Winnipeg, where I was from, to practice in the first 15 years of my career. I saw a chiropractor when I was young, and I had a lot of knee pain. I played hockey, and I really was being restricted by the pain that I was experiencing. And my father heard of a chiropractor and decided to take me to that chiropractor to get some help. He examined my knees, took x-rays, found out what the problem was, and started to do treatment. And that really helped me because up until that point, I was held back from playing at a higher level by my knee pain. As my knees healed, the chiropractic care continued to make progress. I thought about becoming a chiropractor. I had a couple family members, an aunt and uncle, that were chiropractors as well in Ontario, and they were an influence on me too. I really thought if I could help people with the kind of pain I had, if I could help people in other ways, like my aunt and uncle was how they were telling our family about the different conditions that they were helping people with, I thought that's what I wanted to do. So when I was a teenager, I decided I wanted to become a chiropractor. We moved to the Okanagan in 2008. I practiced in Penticton, and then after that, our family moved up to Kelowna so my children could go to university. I've started a practice in Kelowna now, and we are accepting new patients. And I do stretches and exercises. I go to the gym 5 or 6 days a week. And I'm also a runner. I love to run and have participated in a number of half and full marathons. So you probably have the basics down. You've done some stretches and exercises, and maybe you're curious as far as what you can do to help yourself at this point to strengthen your back, to get more flexibility out of it, to help it to feel better, and to prevent reoccurrences. So that's what we're going to go over today. Just a disclaimer, if you have not seen a health professional for your back, I encourage you to go see a chiropractor or a similar professional to get the proper diagnosis. Once you have the proper diagnosis, it's easy to treat the back and to give stretches and exercises at home. So see a health professional. These stretches and exercises and strengthening may not be best for everyone. So make sure you get that diagnosis and you're working with someone. Just to review the anatomy and physiology of the spine, there's 24 vertebrae in the spine. There's 3 curves to the spine. The neck curves in, the mid-back curves out, and then the low back curves in. There's discs in between the bones. They're like shock absorbers, but they're flexible. They allow you to bend and twist. They're kind of like jelly donuts with the fluid in the middle and a fibrous tissue, a dough on the outside. There's joints and cartilage. So in between the bones, there's a cartilage surface, and then there's some fluid in there called synovial fluid. And so when you move, bend, and twist, the spine is there to protect the spinal cord, but it also allows you to do the activities you want to do. The main movements in the spine are flexion, going forward, extension, which can be difficult, going backwards. It tends to put the most load on the back part of the spine where the facet joints are. There's twisting, and then there's side bending. So those are the main movements of the back. For advanced stretches, we want to get the back stronger. We want to increase the core strength in the back, provide maximum flexibility to the spine, and prevent injury or reoccurrences. One of my favorite exercises to do and recommend is called the plank. The plank allows you to stabilize your spine, tighten the muscles around it, the abdominals, the extensors, and the lower back. So for the plank, initially I recommend that people hold that position for 3 to 5 seconds to start, build up the strength, maybe do it 1 to 3 times at the beginning when you're first starting to use it. Give it a day or two in between doing these planks at the beginning, and then work your way up to do 5 to 10 repetitions of holding 3 to 5 seconds initially, and then you can progress to 5 to 10 seconds or even longer. You can do the plank a little bit lower, so lower to the ground, more parallel, and then that tightens different type of musculature and provides more core strength. The bridge is something that I like to recommend, and that provides core strength in a different way, and it allows you to tighten the abdominals again, tighten the lower back, and then the muscles in the hip region. It works the back extensors. Hold that for 1 to 3 seconds, and I would do that 1 to 3 times. And then as you get good at it, work your way up to 5 to 10 repetitions of the bridge, and then holding for 5 to 10 seconds. Twisting is good, but it is an advanced exercise. I wouldn't recommend twisting to someone that has back pain and initially comes in the clinic. It's not one of the first exercises that I recommend. I usually wait for the patient to progress to the point where they can handle twisting, because twisting can be a little bit harder on the spine. It involves muscles in the disc. So you definitely want to talk to a health professional before you do this. Someone that knows your back. So for twisting, it involves rotation of the spine. It does involve the abdominals. It does involve the back part around the spine, the back extensors, the lateral muscles. And you should be holding for 1 to 3 seconds, doing that 1 to 3 times, and then working your way up to 5 to 10 repetitions for 5 to 10 seconds each. So kind of holding at that end range of motion. You don't want to be feeling an increased amount of pain when you get to the end range. But what you do want to feel is increased stretching, feeling like you're accomplishing more flexibility, but there shouldn't be any sharp pain. Forward flexion is good. So bending forward, you can do this in a standing position. It stretches the extensors along the back part of your spine. And it does flex the hips as well. Hold this for 1 to 3 seconds. You can do this 1 to 3 times to start. Again, give it a day break in between doing these exercises, just to get your body accustomed to it, and then do 5 to 10 repetitions, holding for 5 to 10 seconds. This exercise I call the prayer or puppy pose. So you want to be down on the mat, kneel at first, and then let your hips sag back and then your body extend forward. This maximally stretches the back where it joins into the hips, and you should hold this for 3 to 5 seconds and do this 3 to 5 times to really stretch out that lower back. As far as abdominals go, a good idea is to strengthen the abdominals to get the abs stronger so they can support the spine and give you the strength in case you need to lift something. If you're twisting and trying to reach for something, the abdominals are very important. So to strengthen your abs, you want to do something like this, where you reach up, try and touch your toes, and get the knees or the legs off the ground. A simple sit-up, you can have your legs on the ground and just crunch the abdominals. But as you get more advanced, you want to raise the legs up and then reach for your toes, contracting the abdominals, bringing the rib cage down to the hips and really crunching those abs. This will build up core strength. You can hold this for 1 to 3 seconds to start, then work your way up to 3 to 5 seconds. And for repetitions, I'd recommend 1 to 3 times, working your way up to 5 to 10 repetitions. And I would do this every other day. For lower abdominals, you can raise your legs off the ground. So bringing the leg up or both legs up at one time. Some people do this where they actually bring their pelvis off the ground, kind of a reverse sit-up, and that will help to crunch the lower abdominals and strengthen the attachments of the abdominals down into the pelvic area. So as far as this exercise, hold it for 3 to 5 seconds. Do this 3 to 5 times for each leg, and you might want to do both legs together. For back extensions, you can have yourself flat on the mat, push your upper body off the ground, and this will stretch your abdominals. It'll contract the back extensors along the spine. It'll stretch the back joints, including the front part of the spine where the discs are. You want to hold this for 3 to 5 seconds, and I would do this 3 to 5 times. Superman. The Superman exercise is where you're going to strengthen your back extensors, and I like this one because it goes higher up your back, so it really does the extensors from the lower part of your spine up into the middle part of your spine. So again, this helps with core strength. You can lie on a mat, raise your arms off the ground, and then raise your legs off the ground, holding that for 1 to 3 seconds. Then work your way up to 3 to 5 seconds. Do this 1 to 3 times, and then eventually get the repetitions up to 5 to 10 repetitions. I would space this one out by every second day, maybe even every third day at the beginning, because it is quite strenuous on the back. And again, consult with a health professional before you do start doing the Superman. I like doing this exercise where you're extending the opposite arm and the leg to kind of cross over with strength in the upper part of the back and the lower part of the spine. And it takes some coordination and core strength to keep yourself balanced. So I like this one for coordination, for core strength. Hold it for 1 to 3 seconds, then work your way up for 3 to 5 seconds. And 1 to 3 repetitions is good at the beginning, and then 5 to 10 repetitions as you get good at this exercise. And then side bending, you can spread your legs out like this, face forward, and then tip sideways, trying to get your hand down to your foot. If it can't get there, then work your way up. Don't force it. This exercise requires some coordination, and it also works the lateral muscles, the side muscles along the spine. And it'll produce core strength and flexibility. So tip sideways, hold it for 1 to 3 seconds, then work your way up to 3 to 5 seconds. Do 1 to 3 repetitions, and then eventually get up to 5 to 10 repetitions. If you have back or joint pain, feel free to give our office a call. We'd be happy to assess you. We're taking new patients now. Find out what's causing your back pain, do the right treatment for it, and then recommend exercises and stretches specifically for your condition. If you're interested in reading my book, it's on Amazon. It's called Back Pain. And there's a Kindle version as well as an audio version. You can go on to Amazon.com or Amazon.ca and then just type in back pain, and you can put in my name, Dr. Cary Yurkiw, and then the book will come up. We don't have exercises in this book, but we do plan on getting stretches and exercises in the next edition. So we're working on that. This book was published last year. If you want to sign up for our upcoming webinars, feel free to go to our website, caryurkiw.com, click on events, and you'll see a list of the upcoming events. You can also go onto Eventbrite and then type in Yurkiw Chiropractic, and you'll see tickets for the upcoming events. Register for it, and then you'll get sent a link the night before or the morning of the webinar. We're located at 105 1628 Dixon. That's the Landmark 4 building in Kelowna. Our phone number, 250-486-0062. So if you have questions, you can certainly give us a call or send us an email at drcaryurkiw@gmail.com. Sometimes what we'll do is, as we progress through treatment, we will prescribe exercises for our patients. And then we started to use telehealth, where we can follow up with the patients and they can be in their home and they can show us how they're doing the stretches and exercises. So we have been using a platform called On Call. It's a secure platform where we can monitor our patients' stretches and exercises, so they don't have to actually come to the clinic, but we can touch base with them as their treatments progress. So I want to thank you for joining us today. If you have any questions, don't hesitate to type that into the chat. I'd be happy to answer that now. If you want to book an appointment, just give us a call. Be happy to get you in. And if you have any other questions, just give us a call or send us an email. I would be happy to answer those questions for you. I hope you enjoyed this webinar on advanced stretches and exercises for back pain, and we'll see you next time.